The numbers are alarming. 1 out of every 11 Americans has diabetes.
The disease is associated with a variety of health problems, including vision disorders, even blindness. In today's Health Check, Delane Cleveland has more on what diabetics need to pay more attention to.
So this is the meter strips I take.
In Brian Nord's Plymouth home,
This is my insulin pump here.
a collection of glucose tablets and glucose reading gadgets sit at the ready.
That's telling me that my blood sugar right now is 98, which is pretty much ideal.
Brian is one of more than 29 million Americans living with diabetes.
Most people that see me wouldn't figure out that I have this chronic illness. And, it doesn't look like cancer, and, it doesn't look like AIDS.
In the past few years, he's become an advocate, taking part in walks and working to raise money to find a cure.
It's very important because if I don't take my medicine for one day, I'm in the hospital in the emergency room.
It's a serious concern, but for diabetics, blood sugar isn't the only thing they need to worry about.
Diabetic eye disease is actually the leading cause of preventative loss of vision and blindness that we see.
Dr. Tina McCarty of the Eye Care Center in Maple Grove says it's imperative that diabetics get comprehensive eye exams annually.
A lot of times, early diabetic eye disease is either symptom-free or the symptoms are so subtle that patients don't make that correlation.
After dilating a patient's pupils, she uses a lens to look for signs of diabetes such as glaucoma or changes in the blood vessels.
Particularly leakage in the form of blood or fatty fluid that could indicate a problem, but it could also cause loss of vision.
As for Brian,
I'm more susceptible to cataracts and glaucoma because of being a diabetic.
he keeps close tabs on his vision, but he hopes for a day when they find a cure for diabetes.
There would be no better feeling in the world than that.
For Health Check, Delane Cleveland, 12 News.
If an optometrist identifies something in the eye related to diabetes, they would correspond with the patient's physician, and the next steps could include injections or surgery.